Does the judge only use it when it's a verdict, or are there other times the judge gets to use the gavel?
When they're trying to regain quorum or trying to get people's attention.
Most people are used to the whole banging of the gavel and the order in the court. A gavel is used to get everybody's attention. The fun thing, at least at our law school, is that for competitions or achievements, we will actually give out gavels as awards. Let's say a negotiation competition, first, second, and third place will get their little mini gavels. So they're pretty good keepsakes, at least as far as acknowledgments and recognition. But once you do get to the point of being a judge or a justice, it does come in handy.
Speculums, as you said, it's meant to help open up the vaginal vault so that we can take a look inside
Is
and make
that
sure.
really what it's called?
The vaginal vault, because it is the vault of the vagina, right? We're all professionals here now.
Tell me more about the vaginal vault.
Medicine,
Law, friendship. This is Dr. Long and Lawyer Nik. You're listening to the Medico-Legal Brief.
one doctor, one lawyer, and a whole lot of gray area.
Hello, everyone. Welcome back to the Medico-Legal Brief, where medicine meets the law. I'm Lawyer Nik. I'm with Dr. Long. If you haven't already, please go follow, like, hit that little button that says subscribe, leave comments, and share with your friends. We love engaging with our listeners. If there's anything that you want to hear us discuss, please let us know. With that being said, we have a pretty fun podcast for you today. Today, we're going to start talking about some of the tools of the trade. So Long and I have gone back and forth in the past asking each other questions of what exactly is this used for and what is that used for? This will be a good podcast trying to figure out what these tools actually are.
Right. And it's going to be very similar to our previous episode, if you want to check that out, where we did medical and legal terms. So it just helps each other understand each other's profession, but also it's going to be a little funny to see what we think the tool is used for and how it's used.
To start, we're going to go back and forth, but Long, I'm going to show you a picture from the legal profession. It might be an item, it might be a place, and I would like for you to tell me what you think it is. Give some background, give some discussion, and then I'll add some feedback, and I'll describe what it's actually used for. The items I'm going to show you is probably going to be a lot easier than the items that you plan on showing me, though.
I'm going to start off pretty easy for you, but yes, they're going to get a little bit more difficult near the end of the episode.
Okay, so would you like me to go first, or do you want to go first?
Let me go first, since I have a couple more items than you do.
Okay.
All right. You ready for this? Our first item. So it's going to show up on screen here.
So
what do you think that is? What is it called and what is it used for?
So I'm gonna be honest. I have no clue what it's called. I'm gonna call it the little pumpy arm thing. I actually went to the doctor yesterday just for general health checkup since we got baby girl coming our way here in a week or so, and that is something that the nurse strapped on me. So from my understanding, that monitors blood pressure. I might get this wrong, but if I recall, they put it on your left arm, and then they pump it up to, I guess, get a pulse. And then at that point, they put the stethoscope under it to then listen to the pulse and then time it to see what your blood pressure is at.
That's a very watered down version of it. Yes, you're right. It's a blood pressure cuff. It doesn't matter which arm you go. And actually, sometimes we have to use a leg, a forearm. It's just a way to measure the blood pressure, the pressure within your blood vessels. I don't want to get into the science and the medical details of how that's measured. But yes, you put that cuff on, it constricts the arm or the leg, and then you put your stethoscope and you wait and listen for different tones, which then allows us to determine how high your blood pressure is. But I actually struggle with the name of this too because it's a very hard term. So blood pressure cuff is what we call it as a lay person. And as we talk to patients, we say it's a blood pressure cuff. But in medical terminology, it's actually called sphygmomanometer. If you want to try to say that multiple times fast, it's very hard.
Sphygmomanometer.
Sphygmomanometer.
Yeah, I'm going to tap out on that one. I'll go with blood pressure cuff.
Exactly.
Question for you, because I had this question for the nurse, because I was wearing a bulky sweater, a bulky crew neck, and I was like, do I need to take this off or are you fine? She's like, no, you leave it on. Does material impact it at all, or is it the thickness of the material can impact it?
And now if we're going based on best practices, things that are recommended, yes, it should be on a bare arm. It should be skin, right on skin if possible. Any sort of change or deviation from that norm can affect the blood pressure cuff readings. I personally always have the patient roll off roll up their sleeve or take off their shirt so that I can get skin to skin contact. And that way my stethoscope will go exactly where I need it to be without any issues or any interference at all.
So what's kind of the normal range of blood pressure?
Ideally, you're as close to 120/70 as possible. I usually tell patients to focus in on that top number. It's more important. When we start getting concerned that you are getting close to high blood pressure or hypertension is if that top number goes above 140. So the high blood pressure definition would be anything over 140/90.
Hey, okay. And why the two numbers without getting too much
So
into the science?
yeah, so the two numbers again indicates a systolic versus a diastolic pressure. Again, it's just the way the heart pumps, and so we like to determine if one part of the heart is pumping harder than the other. Again, not wanting to get down into the details, but the one that most people should focus on is the systolic, and usually we focus in on that for medication management.
Okay. Yeah, I found out my blood pressure has dropped back in the normal range. I was 118 over, I think, 68 or 78. So my wife was very happy because she's like, okay, less stress in your life right now until our child comes, and then it's going to ramp right back up. All right. I have one for you. I am showing you the image right now.
All right, that looks like a gavel. That is pretty easy.
It's really
It's
easy.
what the judge uses, right, to say this is the verdict or this is what they've decided.
Yeah. So the actually, let me ask you this. Does the judge only use it when it's a verdict, or are there other times the judge gets to use the gavel?
I think when they're trying to regain quorum or trying to get people's attention, if there's a distraction or if there's arguments across and they're trying to get focus back onto them, then they'll use the gavel to get that.
Yeah, most people are used to the whole banging of the gavel and the order in the court. So yes, a gavel is used to get everybody's attention. The fun thing, at least at our law school, is that for competitions or achievements, we will actually give out gavels as awards. Let's say a negotiation competition, first, second, and third place will get their little mini gavels, and it'll say first place, Texas A&M School of Law negotiation champion. They're pretty good keepsakes, at least as far as acknowledgments and recognition. But once you do get to the point of being a judge or a justice, it does come in handy.
So is everyone allowed to use a gavel, or is only the judge or justice allowed
So
in terms
only
of
only
the
the
law?
judge and or justice. Nobody else in the courtroom has a gavel. We'll get into some other players of the courtroom a little bit later, but yes, nobody else is bringing in a gavel or any sort of noisemaker into the courtroom. It's a good way to find yourself in contempt and thrown in jail for the night.
Got it.
Yep,
All right, ready for my next one?
I'm ready.
Okay. Again, another easy hitting one.
Oh, wow, this is really easy. So that's the little necklace thingy that doctors wear. That's a stethoscope. You put it in your ears and then it helps you listen to things, from my understanding. You can listen to the heart, you can listen to the lungs. I'm not sure if you can listen to anything else, but yeah, that's a stethoscope, I hope.
You got it. Yep. Stethoscope. It helps amplify sounds and noises that we can hear in the body. The majority of the time, you'll hear it from the lungs and heart. You can also listen to abdomen. Sometimes you can listen to the neck for some bruits. These are all areas that we can listen for and listen to just make sure there's nothing that is sounding abnormal. It basically amplifies the sounds what's inside of you, and it helps us determine if there's a concern, something that we need to work up more. It's a really good tool to have, and most of your doctors will usually carry it around with them. Unless you're a very highly surgical specialist, then you'll probably never see a stethoscope again after you graduate medical school.
Am I allowed to talk when the doctor is using the stethoscope, or does that impact what they're hearing?
You're allowed to talk, but it's hard to hear if you're talking because then it's going to echo that noise, that voice down into the area that you're trying to listen to, especially when you're trying to listen to the heart or lungs.
So if you had the stethoscope in your ears and I grabbed the end of it and I yelled into it, that would probably hurt really bad then.
That would be terrible. Yes.
Did y'all ever used to do that to each other?
No, because we're not childish.
I don't know. Med students can be pretty childish. I know us law students were. All right. I got the next one coming up for you. This one's going to be really, really hard. Like really, really hard.
Is that it?
That's it.
Okay. That looks like a pen and paper. Pad, and notebook pad, and yeah, paper, pen.
What do you call the pad?
Paper. I don't know. Notepad. Is there a special term that you use in the legal world?
Yes, it's called a legal pad.
Oh
Whenever
my
you
goodness.
see
Are
the
you being
yellow
serious?
pads, everybody refers to it as a legal pad. I personally hate legal pads. I like notebooks because I cannot stand flipping it over. I like being able to write on the front and the back. But these legal pads, they're used in the corporate world all the time, but everybody has them as a lawyer. You always have some way of taking notes because we're writing so much. But yeah, it's a bright yellow legal pad.
Even nowadays, you're still using legal pads. You haven't transitioned over completely electronic.
Some people will transition to electronics. There's a lot of note-taking software that's out there. On our AI episode, you even talked about being able to speak your notes into an AI software program via microphone and have it edit your notes for you. But for me personally, I write things down. It's a way to memorize. If I need to get a lot of information quickly, I will type into a Word document or a Google document. But for the most part, I like working with a pad because the writing and the repetition allows me to put it into my memory a lot easier. I used to go through legal pads in both my legal career and my aerospace career all the time if I didn't have access to notebooks just because of how much I would write stuff down.
Got it. And it's probably because you're old.
Yeah, yeah, that too. Remember, with our tech episode, I was pushed away from tech, so I'll stick with my legal pad.
All right. My next item for you is another tool that we use in the office regularly.
I do not know the name of this tool. I don't know the name of any of these tools, but I'm pretty sure that allows you to look and get a magnified view of certain things, and it has a light on it as well. So you can look into my ear, you can look into my eyes, you can look down my throat, you can look at my nose, and it gives you just a better overall view of what you're trying to look for.
That's right. So you are right. It's called an otoscope because it's actually specifically used for the ear. However, because it has a light at the end of it, it's really helpful to look in the nose and mouth with the same tool rather than switching it out. Now, you are thinking of an ophthalmoscope, which can be used to look behind the eye or inside the eye. And that looks more like this. And they usually go hand in hand with the
Okay.
otoscope. Usually, if you're in an office, you should be able to see both of those tools side by side so that the doctor can use to look in your ears, switch over, look behind your eyes, and then use either or to look inside your nose and mouth because it has that light source.
When it comes to tools like that, are there certain versions that doctors pursue? Generation one versus generation three. As we're going more towards tech, I would assume that the lighting can get better on these things and the magnification can get better on these things. So do you guys keep up with the times and the tech when it comes to the tools like that?
Absolutely, but also it's more about brand name, right? There are the brands that have been out there for decades and they are usually more trustworthy. We trust them a little bit more in terms of effectiveness as well as accuracy. You tend to follow the trends of those brands. But as you can kind of mention, keeping up with the times, things have gotten more and more crazy because look at this tool. That tool is the exact same tool you would use for the ophthalmoscope, except it's more fancy. It's the bougie version.
Now, do the bougie versions cost a lot more than the regular versions?
It usually does cost a little bit more. But could you imagine sitting there and your doctor's like, I'm going to look in your eye and this is what we're going to use?
Yeah, it
Yeah.
almost looks like a sprinkler head or
Yeah.
a hose. It's like, what are you about to do with me? That looks like a futuristic like laser
Yep.
gun or something. All right, the next one I have for you is not a thing, it is a location. I have it up right now for you.
That looks like a courtroom to
It is
me.
it is a courtroom, but specifically this section of the courtroom.
Is that's not the jury stand.
It is. It is.
Oh, it's behind. I see it. Okay. I
Yeah.
see. The jury sit there and you can see the front of the court. Got it.
Yep. It's in the name. It's a jury box. But what is this used for?
I'm assuming it's for all the jury members to sit and listen to the arguments, and then that way they can make their final decisions at the end.
That is correct. So in every courtroom, there is a juror box and there is a bunch of seats in this juror box. And depending on your jurisdiction, depending on what the laws in your state call for, there could be anywhere between 6 to 12 jurors, maybe even less, maybe a little bit more, depending on where you're located. This is the prime seating for the jurors. It allows them access to see the attorneys and the judge and the witness stand. And if any sort of evidence is being presented, it gives them the front row seat. So they'll go from this juror box back into the jury room and then back out into the juror box. And anytime they need to take a break, they'll leave this area. That way they're not influenced by anything in the courtroom. And if the judge ever needs to have a conversation with the parties outside of the juror's ear, then they'll send the jury back into the jury room and they'll sit there, and that's where they'll talk and have discussions and review things. But when it's game time and we're looking at the trial, this is where they will sit the entire trial. So not the most comfortable seats, and I don't think they're supposed to be comfortable. You don't want to be having your jurors fall asleep, but you also don't want them to be so fidgety that they're distracted. There's definitely a fine line and a balance with these seats.
Have you ever done jury duty before? Because that's something that's mandatory here in the US, right?
I have been called for jury duty 3 or 4 times, and one of the times I was in college, so I got an exemption, and there exists exemptions for certain things depending on your jurisdiction. One time I actually had to go, and I had to go through the process of voir dire or voir dire, whichever way you pronounce it. And basically, it's jury selection. You go into a courtroom and you sit with 50 other potential jurors, and that's where they actually select the jurors for the trial. I've never been selected for an actual trial, and most of the time I know people are afraid of getting selected for jury duty because it's a lot of pressure and it's a little bit of the unknown. But a lot of cases don't actually get to trial, so there are worlds where you are selected for a jury, and next thing you know, trial's canceled because the attorneys have reached an agreement there on the courtroom steps 5 minutes before trial is supposed to happen. It's very hit or miss, but I would say it's a U.S. citizenship duty. I should say it's a duty of our country, and it's actually a pretty fun process if you can get through it. One thing I would recommend for everybody, though, a lot of people have this notion that they can say these very ignorant or blatantly inappropriate things in court. I would not recommend that. Judges are smart, attorneys are smart, and in some cases, what you say might be on the court's record. You might, spit out something that is extremely horrendous, thinking it's going to get you out of jury duty, but it might cause more problems in the future if it's on the court record.
All right. I got an item for you.
Okay.
We'll see if you can appreciate what this is, though.
Oh my gosh. So again, I do not know the name of it, and I don't know if it's used for other things besides the thing I am about to uh, describe. But from my understanding, that is primarily used by OB-GYNs to look into the female part and to get a good view and separate things. That way you have a great angle and you can do a appropriate female examination.
Yes, it's called a speculum. So speculums, as you said, it's meant to help open up the vaginal vault so that we can take a look inside
Is
and make
that
sure
really what it's called? The vaginal vault?
the vaginal vault, yes, because it is the vault of the vagina, right? We're all professionals here, Nick.
Oh, we're gonna get canceled, but that's okay. Keep going. Tell me more about the vaginal vault.
So it's a speculum. It opens up the area so that we can have a better view. It is not very comfortable. I've never had it personally done to me, but I've done it to other people, and I can tell you, it just looks uncomfortable. But it is the best thing that we have at this time, so that we can get a better view of the cervix, making sure that there is no abnormal bleeding, no abnormal tissue. Everything is closed like it should be. Women also have to go through cervical cancer screenings every 3 to 5 years, depending on age. And that's just to determine whether or not there is any cancer cells, precancer cells, anything that we need to keep an eye out on early on so that they don't have to suffer through the actual cancer diagnosis in the end. And so, yes, that is a very common tool that not only OBGYN use, but primary care family physicians also use it if they practice a little bit of OB and do gynecological procedures in the office.
Now, correct me if I'm wrong, that looks extremely invasive. Do most women report back that it is as invasive as it looks?
Yes. I don't think any woman enjoys it, looks forward to it. Everyone tries to avoid it as much as they can.
That makes sense. That makes sense. I'm glad I never had to come into contact one. So
I imagine what women go through for this speculum exam is what men go through when they have their prostate examined. Not a finger, but I'm talking about the camera up the urethra. I imagine that that's what it feels like.
yeah. Ouch.
Yeah.
Ouch.
Yeah. That's the ick that women feel when they hear speculum.
Yeah. Okay. All right. I got the next one up. Let me know what you think it is.
I know what it is. I'm not sure what the name is. I'm just going to call it a typewriter, but I know it's what the transcriptionists, but I know there's another term for them too that they use this to shorthand the notes during the trial?
Yes, so it is a stenograph. So court reporters will use it whether they are in court or whether they are taking a deposition. And you described it perfectly. Is shorthand, which they're trained in, and it is just like a typewriter or a keyboard where there's typing out the transcript live while court's going on. We talked about this in one of our other episodes. I believe it was the AI episode that we talked about this in, where the court reporter will record what's going on and they will also listen and type things up, and they will create a complete transcript of everything that's on the court's record, whether that's in a trial or in a hearing or even in a deposition. And when you're doing this, you're under oath, so you can refer back to these notes to see, okay, did somebody lie? Did somebody bend the truth? Was their memory a little worrisome at the time? So there's definitely a lot of use in this, but with AI, we're gonna start seeing some changes when it comes to court reporting, as well as getting accurate transcripts from the court. But yeah, as of right now, the court reporters get training in this and they use a shorthand. I could not tell you how it's worked because they type so freaking fast, and it is just amazing that they can competently and accurately recite back, because even with the recording as a backup, you'll be in court and the judge will ask the court reporter, can you please read that back from the record? And they will go back 5 or 10 minutes and they will accurately say exactly what happened from 10 minutes ago, which is extremely impressive.
Very, very. I've had a single patient before that was going through that schooling, and she talked about the rigor of basically learning a new language so that you can interpret or translate the English language.
Now, in medical, don't you guys have individuals? I don't know if it's officially like a note taker duty or if it's just a nurse or a student, but somebody who transcribes your notes sometimes while you're going through your rounds.
So yes and no. One, it was the old way of doing it. So we used to have what we call scribes, and these are specifically hired staff that will help type notes, put in orders, make the physician a little bit more efficient. Nowadays, we have AI for that. We have voice transcriptionists. Everything is a little bit more electronic. However, there are still older docs or older physicians who have not adapted the new AI technology. Therefore, they are still utilizing scribes. But scribes, I do think that they are falling out of favor nowadays, and we don't use them as much anymore. But yes, they were a person, a staff member that would go into the rooms with the physician and the patient to help type up their notes and put in orders as the physician is doing the exam and doing the legwork.
And did scribes need to have any sort of medical background, or was just the ability to type accurately?
Scribes have to have some medical terminology background. They have to be able to understand the terms that are being utilized by the patient as well as the physician so that they know to type the right word. For example, if I use the medical term for a blood pressure cuff, you would have to know that it's a blood pressure cuff to be able to type that in the note versus someone who didn't know, they wouldn't be able to type out the actual word.
Makes sense. Makes sense. Were
Yeah.
you ever, did you ever have to do scribe duties or anything of the sort?
I was a scribe before I started residency. Yep.
Yeah. Did
Did it
you
for a
like it?
couple
Did you
months.
enjoy it?
It was fun. It was interesting, but no, not something that I could see myself doing for a very long time.
Mhm.
It used to be a very good stepping stone to get into medical school because it showed that you showed initiative, that you got some exposure to medicine, that you had learned some medical terminology. So it was a good resume booster. And so a lot of people do have some scribing history if they plan on going into medical school. But that, again, has started to fall out of favor and become harder and harder to find because most people are utilizing AI nowadays.
Makes sense.
All right. My next one for you is going to be a follow up to that speculum. Okay.
Okay.
So just so you know where things go, what do you think that is?
That is a toothpick. I'm kidding. I'm kidding. That is an IUD, which helps prevent pregnancy.
Got it. Do you know what the IUD stands for?
Gosh, I have no clue, but I know that, if correct me if I'm wrong, it's packed with hormones that does like a release in the woman's system, acting as a form of birth control.
You got it. So the IUD stands for intrauterine device.
Mm-hmm.
Therefore, IUD. It is usually made of a material that will hold on to progesterone, and that is specifically the only hormone that most IUDs have. The only alternative to the IUD that is not progesterone would be the copper IUD, and so that is specifically copper, no hormones at all. But yes, it is a IUD device that gets inserted into the uterus. It sits in there between 5 to 10 years, depending on which device you have inserted, and it slowly releases progesterone, which then helps reduce and prevent pregnancies moving forward.
How does a device like that know when to release a hormone, especially over that vast of a period of time, 5 to 10 years, where it's just inserted and it just stays? How does it accurately and competently, you know, solve that problem? I guess I'm asking.
It doesn't have to do any of that. The only thing it has to do is just slowly release it at the same increment every single day at every single moment in time. Basically, the reason that we keep it in for 5 to 10 years is depending on the deterioration or how quickly the hormones are released and dissipated from the device itself. So there is no spike. It's supposed to be an even keel release of hormones throughout the lifetime of the device.
And does it just kind of seep out at that point? Because I imagine there's no machinery in this thing. It just is plastic or what have you.
It essentially is just a plastic, almost feels like a rubber item, and it just goes in there. And yes, it just slowly releases it so that the body then absorbs it.
I've heard that those things can be extremely painful when it comes to inserting them, not for actually having them.
Yes, inserting, depending on if you've had pregnancies in the past, can be very painful because, again, imagine your cervix. If you've never pushed out a baby through the cervix, then it's going to be very tight. It's going to be very hard to then insert a foreign object into that area. But if you've had a pregnancy before and had a vaginal delivery, then the cervix is going to be a little bit more friable. It's going to be a little bit easier to insert. It's not going to be as painful. Even then, there are tools that we utilize like Tylenol, ibuprofen before the insertion, as well as cervical blocks that we can do so that it helps numb up the cervical region before we insert it. But again, not a fun procedure. But if you only have to do it once every 5 to 10 years, sometimes it's worth it for the woman.
I've heard that as far as birth control choices, that is a preferred one because then you don't have to rely on taking a pill every single day or relying on other forms that may not be as reliable, I should say.
You got it. Yep.
All right, back to me. We are making our way back into the courtroom. What is it that we're looking at here?
So it's right next to the judge's desk, and that's where the person that's sitting there getting grilled. I know what it is. It's on the tip of my tongue, but I can't seem to find the words. But it's the person that sits there and they have to answer questions as the attorneys grill them.
So that is the witness stand.
There you go, witness stand.
I like your description a little bit better though, where the person sits to get grilled. So yeah, this is a witness stand. Whenever the counsel or the attorneys decide to call a witness, this is where they go sit. Usually there's a microphone in front of them. You'll have a jug of water, you'll have tissues, because you don't want distractions while you're up here. You know, you're not going to have a giant computer screen unless they need to show you something. You know, there are some courtrooms that when they're presenting evidence now, it's not just holding up a big, poster board or a big whiteboard. They actually can upload the evidence to a drive and share it on a TV screen for everybody in the court to see. Again, technology advancing. If you are called to the witness stand, this is where you come sit. This is usually right in front of the jury box. So then the jurors have a good look at you. And then it is right next to the judge. So if the judge needs to communicate to you, they can communicate and, talk down to you. Not talk down, but there is an element of the judge being one of the highest people in the courtroom by the very nature of where they are located. And usually they sit atop a perch that they can see the entire courtroom. Opposite the witness stand, so if you think about it, most courtrooms, you have your witness stand, you have where the judge is located, and then exact opposite is the court reporter. So the court reporter can still be in that location, but still hear things and still communicate with the judge and see the courtroom. But yeah, this is where you go to get grilled if you are a witness.
Hope I don't ever find myself in that spot.
No. And that's the crazy thing. A lot of people don't understand. I don't want to deter anybody from ever filing a lawsuit or reporting criminal activity. But if you are a witness or if you are a potential witness, you could be subpoenaed, which is a formal request from the court to show up and either provide evidence or provide yourself. If you are subpoenaed to the court, you are essentially being forced to show up and then give your testimony. You might, report a crime to the police and you might not think anything of it. But if that case goes to trial, you might be called as a witness because you were the one who witnessed the crime and you were the one who now needs to testify. So then the prosecution could then prove up and submit the evidence of your testimony to put somebody in jail. A lot of people don't consider the fact that in the future, if they call the cops, like they could end up as a witness. If they see an accident, they could end up as a witness. Like you can be called as a witness for legal things. Don't be deterred from it. It may or may not happen, but you just have to be cognizant of the fact that you could be a witness in any sort of case.
My next item, it's going to be a tough one.
Okay. Okay, it almost looks, from my angle, it almost looks like the night vision goggles from the original Jurassic Park, where they're wearing the helmets and they're in the back of the Ford Explorer and they drop them down and they have all the binoculars and the glow stuff around the eyes. Is that what it is?
Not at all.
Oh,
And it's hard because you can't tell the dimensions as well
yeah.
as compare it to what a human size would look like. But that is actually what we call a Lucas. It's a newer technology over the last couple of years. It's actually a machine that will help do chest compressions. So it's a CPR machine and it's fully
Okay.
automated. Yeah. And so it wraps around the patient's body. You strap the patient's arm on top of the machine. That way, you know that the arms are out of the way. And then the compressor is right at the center, and that will then put enough pressure to compress and break through the ribs and compress the heart while they're getting transported to the hospital. So the reason it's called a Lucas is because the full name is Lund University Cardiopulmonary Assist System. So that was developed and created at that specific Lund University, and now it's starting to become more widely used, especially out in the field. When you don't have enough EMS or personnel to be doing CPR, this can help take some of that pressure and stress off the human elements and allow them to focus on other transportation modalities.
Back in the day, I was a lifeguard for 3 or 4 years. I was actually an aquatics coordinator of a local YMCA. We had to go through lifeguard training, and obviously one of the biggest things is CPR. And at first, when we started training, it was, I think, like 15 compressions to every 2 breaths. And then towards the end, it was like 30 compressions to every 2 breaths, with data even trying to determine if the 2 breaths were necessary. But one of the things that we had to work on was handing off to the other lifeguards because it's such a tiring process.
Mm-hmm. Yep, it definitely is a tiring process, and the handoff is the most important because CPR, or the compression component, is more important than the respiratory component. If you're not able to get breaths, that's fine. It's more important that you actually do the compressions right away and you stay on task, because that's what's truly circulating the blood around.
Yeah, so it's wild that you can have this machine where it's just your human elements. I think of a paramedic or an EMT or a firefighter or whoever that's helping can then focus on other things while this is doing chest compressions, because there's a lot going on. And usually if you're in that situation, it is a true blue emergency. And so the fact that we have machinery that can step in to help the human element is quite amazing. All right, this next one, you can obviously see that it is a book, and on the book, can you tell me how you pronounce that?
The penal code.
The Penal Code, yes. Do you know what the Penal Code is?
I assume it's like the Bible for lawyers. Is it kind of a book of rules? I don't know.
It's probably one of the Bibles for lawyers, specifically for criminal attorneys. So whether you're a prosecutor or you're a defense attorney, the Penal Code in any jurisdiction, for the most part, lays out criminal offenses and the punishments or penalties for the criminal offenses. If you're trying to ever look up a specific law and figure out the criminal elements of it, you want to look in your local penal code, whether that is the Texas Penal Code or the Wisconsin Penal Code. Sometimes smaller jurisdictions like local townships, they might have a penal code, or a county might have a penal code. But that's where you want to go, because that is to be juxtaposed against torts and civil violations. And civil violations may be very similar to criminal violations, but things might differ. We've talked about before, you can be sued for a assault and battery from a civil perspective, but it could also be a criminal violation. You would be looking at two different codes to determine where the civil violation occurred and where the criminal violation occurred. Whenever you're thinking criminal and you want to figure out the penalties, what exactly is a certain criminal act, you'll want to look in your penal code.
All right. My next item, we're going to go back down to the Vajra Vault. Okay. We're going to be using it down there, and I want you to tell me what you think this is for and what it's called.
Okay. Are those forceps?
No. They are utilized in a similar fashion.
Okay.
However, these are called tenaculums. These tenaculums have tooth-like pincers at the very end. They're very pokey, And what they're meant to do is they're supposed to pinch the cervix, grab a hold of the cervix so that we can tug and then insert the IUD. Yeah, exactly. You
Oh,
got it. So now you know what women have to go through, especially your wife, when it comes to their personal care, their cervical cancer screening, but also more importantly, when they have to go through pregnancies and examinations. It's not a fun process. So treat them
yeah.
well. Treat your women well.
Yeah, there's an appreciation for what they have to go through. Again, vulnerable, right? Podcast. There was an instance several years ago, and I actually think I talked to you about it, where there was felt like a fatty lump in my chest. And I actually had to go in and do, what is it, the mammogram? Is that what it's called? And they put me into the machine, and obviously I don't have breasts, but they had to pinch whatever they could from the muscle and fat that was sitting there. And it was one of the most miserable things ever. And I came back and was like, how do you guys go through this? Knowing that you're actually using in most cases, a pretty major part of a woman's body to pinch and press and take imaging of it. So yeah, what they go through, there's an appreciation there. All right. This is not a thing or a place. This is a person, and it is the person in the uniform.
It's the security guard. It's the bailiff. That just came to me. Bailiff, isn't it?
It is a bailiff. What does the bailiff do? What do you think the bailiff does?
I think he helps keep order. If the judge asks for any help, he's there to assert his authority, I guess.
Yeah, that's correct. The bailiff is a law enforcement officer, and usually there are a few bailiffs assigned to every court, and that is the courtroom that they will always be assigned to, at least here in Texas, because the relationship between the judge and the bailiff is extremely important. The bailiff specifically is there to open up and announce the judge's presence. They are there to keep order. If anybody's getting rowdy in the courtroom, they'll come back and they'll either tell them to pipe down, or they will escort them out, or in some cases they will throw on the handcuffs and bring them on back to hold them in contempt and transfer them on down to the local holding cell. Another thing that they'll do is they'll act as assistants. They'll have the court calendar, and you might come in and say, hey, am I supposed to be in this courtroom? Or, well, do you know what time I'm supposed to be at trial, and so on and so forth? And they'll usually help guide you. So if you're ever lost in a courtroom and you are in a courthouse and you think that you're in the right courtroom, just go up, walk along the side, go whisper to the bailiff, ask them. Most of them are really nice. Most of them will let you know exactly where to go, and they'll try to help. But for the most part, his or her job is to protect the order of the court, protect the judge, protect everybody else. You know, they are armed, they are law enforcement officials, so they want to protect the people in the courtroom and make sure that order is there.
Cool.
All right,
All
what do
right,
you got?
my next item.
That's the thing that Tom Cruise uses in Top Gun Maverick to breathe oxygen while he's going through his jet flying.
No, what he was wearing was probably an oxygen mask attached
Yeah.
to an oxygen tank. So what I just showed you is actually what we call a nebulizer machine. So a nebulizer machine is a contraption that helps aerosolizes medication. So it's usually in liquid form that we then want the patient to inhale. And so this machine will convert the liquid over into an inhalation. We utilize this a lot in patients who have asthma, COPD, especially if they are coming in with active wheezing, struggling to breathe. Then the medications that are necessary to help the patient get better quickly usually have to go through a nebulizer or nebulization.
When you're going through like putting medication in nebulizer, can you put any medication in there? That, like, can you switch it up? Do you gotta put in special order for the medication that will fit the nebulizer?
Of course, the formulations, yes, every medication out there has a specific formula, ingredient, amount that needs to go in, that it has been studied and tested to be utilized in a specific time and place. Yes, you could put any medication into a nebulizer machine so that it can turn into an inhalant, but you don't want to do that for everything. The most common things we utilize are going to be albuterol, which a lot of asthmatics as well as COPD people will use as an inhaler. Because they're struggling to breathe, it's very hard to utilize an inhaler fully and efficiently. We will then put it in a nebulizer machine instead. And so that conversion from an inhaler to a nebulizer machine is a little different. So you can't put one to one. And same thing with other types of medications that we would utilize in a nebulizer machine.
This reminds me of our Ozempic GLP-1 episode where we were talking about the compounding pharmacies. Like, this might be an instance in which you would maybe need a compounding pharmacy to give you a different modality of medication?
Not usually. So usually when it comes to nebulization, you have specific manufacturers, specific medications. Because again, yes, just because you can put it into the machine and the machine will convert it doesn't necessarily mean it should be inhaled.
Now, can you use nebulizers for medical marijuana? Going back to, I think, episode 8 for us.
I'm sure there's always a way to make it work, yes. But again, the way it converts it and how it converts it, I have no idea if it would keep the same benefits or effects that the person using it will want, or is it going to lessen the effects? I have no idea. I don't think anyone's studying that right now.
That's fair. Fair point. All right, so I have two more, and then I am done with my side. So we are in the last location of the courtroom. This one looks a little bit more fun, but what does this look like to you?
This looks like the judge's office. I don't know if there's an official term, but it looks like that's where you would go to the back and have a conversation with them.
Yes, so you are exactly right. It is called chambers. So judges' chambers. You hit the nail on the head. This is the judge's office. It is connected to the courtroom. So usually there is a side door. When you're watching TV, or if you've ever been in a courtroom and you see the judge come in and the bailiff yells, "All rise," they're coming from chambers. This is an area in which the judge can bring back attorneys, bring back witnesses, do their work, have private conversations. Usually in chambers, they have their access to a bathroom and a shower. They have their suit coats and their ties and then everything of the sort just to do what they need to do for the time being. It's really weird to go back into chambers because as attorneys, you're generally called back into chambers a lot and sit there and see the judge in not their natural habitat that you're used to seeing them sit on the stand in the judge position, overseeing their courtroom. When they're back there, it humanizes them a little bit to where you're sitting with them. You get to see some of their personality. Sometimes they'll have their diplomas on the wall. They'll have their favorite sports team. They'll have books. They'll have pictures of their families. So there's definitely an appreciation for going back into judges' chambers and getting to see the personality of the judge that you're in front of.
Yeah, so a little less formal back there. You don't have to be on guard all the time.
Sometimes you do. It depends. Like very laid back conversation where you're just talking about what sports team's going to win this weekend. I've also been back there on the other end of a reaming. So it is something that you have to read the room. You can't just go in there and think that it's so laid back that you can act out. It is something to where you have to read exactly what the current temperament of the room is and what the temperament of the judge is.
All right, my next item, you should be very familiar with it at this point in time, Nick.
So that is an ultrasound machine.
You got it. What do you think we utilize it for?
So ultrasound primarily to look for babies and look for the heartbeat. From my experience, you're checking the height, you're checking the weight, you're checking the measurements. You can even see the blood flow. You can see the little heart palpitations. I've also experienced ultrasounds on different parts of my body as a man going in, and depending on the situation, we actually have to ultrasound to see if anything's going on, maybe in your side or your stomach or your abdomen area. Yeah, you get to rub the gel on it and then you get to look for stuff.
You got it. It's a low to no radiation modality to help view the internal organs a little bit better. Most people hear of ultrasound and they think of exactly what you had mentioned, which is pregnancy and following through the pregnancy, making sure the fetus and baby are healthy and everything looks appropriate. But we can also utilize it to measure the valves and the pressures of the heart. We use it to evaluate for gallbladder issues. We use it to look for specific masses. Say that you have a growth on the back and you want to make sure, is it soft tissue? Is it liquid? Is it something more? Is it something concerning? So ultrasound is a no radiation option so that it tends to be cheaper and most patients tend to agree to it a little bit more. However, it does have its limitations. As you can see, it's black and white, so it's usually very hard to distinguish very minute details. And so again, it has a time and place to be utilized, and that's where your physician will make that determination for you.
Yeah, it was very exciting the first time we went in for our ultrasound, as I'm sure a lot of parents can relate to. You get to see so much and you're not expecting it. I didn't expect to hear a heartbeat. I didn't expect to see little valves and the blood imaging. And granted, it's that bright blue and bright red. But even now, we were in for a checkup 2 weeks ago and they were doing an ultrasound and they made some 3D imaging off of it to where my baby's face looked like some sort of clay mold. And I'm like, oh, that's very impressive. So I can only imagine where the technology is going to go from here.
Mm-hmm.
All right, Long. So this is my last one. Who is this person? And then I'm going to have a follow-up question for you.
I'm pretty sure that's who we call Lady Liberty, right?
Lady Justice. Lady
Oh
Liberty.
gosh.
Yeah.
Okay. I guess you're right. God,
Okay.
I thought I had it too.
So you're close. Lady Justice. There are three things that are a form of representation on Lady Justice, and that is the scales, the blindfold, and the sword. Do you know what each of those things stand for? Or can you take a guess?
Scales, I'm assuming you want equality, equal representation of some sort. So just like equality, making sure it's balanced. Blindfold, I'm assuming, is not to bring in your own personal biases. You want it free of judgment and that you're going based on just the evidence. And the sword is no idea.
You are right on track with the other things. The blindfold, obviously, you do not want to bring in your bias. You want no prejudice. You not want no external influence. You just don't want any bias when you are administering justice and administering the law. The scales, and sometimes we see the scales without a Lady Justice there, but scales of justice, you want objective weighing of evidence. You want fair and balanced decisions in every single trial. You want to get as close as possible to that. And then the sword represents the authority for the law to be enforced. So if there's a judgment, how are we going to enforce that judgment? If there is a criminal act and there's a penalty, how are we going to enforce that? That's what the sword represents. Lady Justice, you'll see her in a lot of courtrooms. She comes from Greek and Roman mythology as a representative as to what justice should be.
Got it. Hey, Lady Justice and Lady Liberty would have fun together going out together.
Yes, they would.
All right, I got one last item for you two then. So this is something I utilize very frequently in my office.
That looks very familiar. What is that?
And no, it's not a toothpick.
Are those dermatologist tools for skin and blackheads and pimples and all that?
No.
Okay, what are they?
These are actually called ear curettes. We
Okay.
use it to clean out patients' ears.
Really?
Yeah.
Okay, because the end of those things, I've seen them on TikTok or whatever, where you can put something flush against your skin and rub it down, and it might help pop a pimple or pull a blackhead
Yeah.
without harming the skin. That's what the tip reminded me of.
The way you know that though is because this is plastic, and usually when you're thinking of a dermal curette, which is more of what if you're thinking, it's usually using a metal or something that is a lot harder and sturdier, so that you can press it against the skin and it not break. Whereas when you're using a tool inside your ear, you want it to be a little bit more malleable so it doesn't cause any injury. And so it's usually plastic that we use in the ear. There are some fancier versions where there's actually a light that could be utilized. You attach the light source to the actual curette. That way, when you go into the ear, you can actually see. And it basically acts like a spoon. You go in and you scoop out the earwax, or cerumen, as we call it. I actually want to follow up that with this other tool. Have you ever had that used on you before?
I have not. What is that? It's
So
spray
that is
bottle.
actually what we call an ear lavage. So same thing, you use it for ear wax, but it's usually for harder to reach places, or if you're not able to scoop the earwax out, then we will use water and flush out the water instead. Not everyone can tolerate this. It's a really weird sensation. It's a lot of pressure. It shouldn't hurt, but if it ever does, then there's always a concern that you might have bursted the eardrum. And so this is not something that should be done at home, but there are a lot of these being sold over the counter so that patients do use it at home. Just be really careful when you do it at home. Just make sure that you know what you're doing and make sure that you have some way of looking back into the ear in case there is pain.
What's your opinion on ear candles? Is that what they are, where they try to do the flame?
You know what? I have no opinion as of yet because I actually want to personally look into an ear, see the earwax, then use the candle and take a look at it after the fact. And then I can give you an answer. I have yet to have anyone allow me that option or opportunity to take a look because, I mean, I don't see how physiologically it could pull hard wax out because sometimes I'm sitting there chiseling away at this wax. I can't imagine a candle could pull that out. But again, I would want to see it in person and utilize it myself and see before and after pictures before I determine whether or not it's useful or not.
Next time you're here in Texas, I'll let you do it. We'll go at it and see what happens.
We'll make it a date.
Well, thank you, everybody. That is all we have on this episode of the Medico-Legal Brief, where medicine meets the law. We hope that you liked this episode. We had some fun with it. We know that we have some serious topics. Recently, we've done GLP-1. We've done MAID, which is medical assistance in dying. We've also done some political and religious topics as well. If you want to tune in, give us a like, give us a follow, and definitely subscribe. That way you're getting that alert whenever our new videos or our new podcast hits. Leave a comment, like, share, and let us know what you want to hear. This has been Dr. Long and Lawyer Nik. We appreciate y'all.
Yes, we're doctors. Yes, we're lawyers. No, this podcast is not medical or legal advice. Do not take anything we say as a reason to perform your own heart surgery, represent yourself in court, or diagnose your neighbor's rash. This is for entertainment only. Think of it like hanging out with your smartest, wittiest friends, not a substitute for an actual appointment. If you act on anything we say without talking to your own professional, that's on you. Seriously, don't do that.